So the CDC is going to spend millions of taxpayer dollars to research gun violence as a health threat.
But now, in a stunning turn, the current director of the CDC is announcing a plan to reduce gun violence, sharing it exclusively with CNN.
This is actually a stunning moment that a director of the CDC is even talking about this issue, is even using the word guns. It hasn't happened in years and years.
No person or organization has stopped the CDC from funding research. It has been prohibited from using tax dollars to advocate or promote gun control since '96, but not from conducting research. There are tons of research done on gun violence. The funding isn't the issue. What they want to do is exploit the CDC's perceived legitimacy to push gun control under the guise of national health crisis. I mean, come on. Think about it. This woman was appointed to this position by Biden, and we all know where Biden stands on guns. Not to mention the position of director of CDC does not require Senate confirmation to take office. So essentially, Biden owns her. So forgive me for not being super optimistic about the fact that this person who owes her position to one of the most anti-gun presidents in our recent history is now going to try to use the perceived legitimacy of the CDC to research the gun violence epidemic. And I'm using air quotes because I've already done a video titled "The Truth About Gun Violence by the Numbers," proving that the US does not have a gun violence problem, much less a gun violence epidemic. But if you think for 1 second that she and the CDC are not going to push gun control under the guise of public health, you're fooling yourself.
Every day we turn on the news and there are more young people dying. I swore to the president and to this country that I would protect your health. This is clearly one of those moments, one of those issues that is harming America's health.
One recent weekend in Chicago, we had 74 people shot. That same weekend, a party in Florida, 5 teenagers shot. That same weekend, a man in New York City, in Times Square, shot in the back, and the list goes on, week after week after week. Can anything be done about this?
Something has to be done about this. So 40,000 firearm-related deaths a year, 120,000 serious firearm-related injuries per year. The scope of the problem is just bigger than we're even hearing about. And when your heart wrenches every day you turn on the news, you're only hearing the tip of the iceberg.
Tip of the iceberg? No, we know exactly what's going on. We've known for years. A ton of people are committing suicide. The vast majority of gun homicides are black teens in the inner city shooting at each other, and a very small number of psychopaths who have almost the same type of background and clear signs of psychological and emotional issues are committing mass shootings. It's not complicated. We don't need the CDC spending millions of dollars to tell us this. Maybe you should have spent that money trying to find out why people are self-checking out. Maybe actually spend that money to actually address the very obvious socioeconomic issues in the inner city instead of ignoring it for the last several decades and acting shocked when it spirals out of control. Maybe spend that money to fix the absolute joke that is our mental health care system. No, instead, you rather have this fake interview talking about how you and the CDC are going to find the answers to questions we already know the answer to.
This time, she wants the CDC to find common ground with gun owners.
Let's agree we don't want people to die.
If your only purpose is to research gun violence and not try to use your research to push gun control, why would you need to find a common ground with us? It should just be objective numbers and stats that you hand over and say, here's what we found. Only reason why you would need to find a common ground is if you plan on advocating for gun control. She just told on herself and doesn't even know it. Gosh.
Let's just agree there. What can we do to stop people from dying?
She wants to allay gun owners' fears.
Generally, the word gun, for those who are worried about research in this area, is followed by the word control. And that's not what I want to do here. I'm not here about gun control. I'm here about preventing gun violence and gun death.
Since she wants to play dumb about why gun owners don't trust the CDC to study guns, I'll tell you why. In 1989, a top CDC official announced, "We're going to systematically build a case that owning firearms causes deaths. We're doing the most we can do given the political realities." In 1993, Dr. Mark Rosenberg of the Services Center for Disease Control said that the Clinton administration wanted to reframe the gun debate about gun control to portray guns as a public health menace. The gun control crowd loves to tell us that people with guns in their home are 2.7 times as likely to become homicide victims as people who don't keep a gun in the home. The statistic came from an article written by Dr. Kellerman and was supported by 2 grants from the CDC. The authors of that article literally admitted that half of the homicides that they used to come up with that stat occurred during the commission of a drug deal or another felony such as robbery, rape, and burglary. You even had doctors like Tim Wheeler, who testified in Washington to the congressional committee in charge of appropriation for the National Center for Injury Prevention and Control, that the CDC funded a gun control group's newsletter, which advised readers to engage in political activism against gun owners. We don't trust you because you've demonstrated over and over again that you can't be objective.
And she wants to involve gun owners in the CDC research to save lives.
If a gun owner said to you, Dr. Walensky, I'm afraid you want to take away my gun.
And my answer to that is come be part of the solution. Come to the table. Join us in the conversation. I don't want you to feel that way, right? I want you to teach me what you have done to make your gun safe. And then I want you to teach everybody else.
Oh, stop it. You only want us at the table if we agree with you. We've been telling you how we keep our guns safe online for decades. You don't need millions to find out what's been on YouTube for free. At the end of the day, I've been in the space long enough to know what soft propaganda looks like. Do we really believe that a guy that says this?
So to gun owners out there who say, well, a Biden administration means they're going to come for my guns.
Bingo. You're right if you have an assault weapon. The fact of the matter is they should be illegal, period.
Is really going to appoint someone who doesn't share his same views on guns? Stop it. You can keep your fake sincerity and we'll keep our guns. You know how frightening it is to think about what happens in the moments before, during, and even days after having to use your gun in self-defense? When you first start carrying a gun for protection, it can be a very scary and nerve-wracking experience, especially if you haven't gotten the education and training you need to feel confident. I've been there myself, hoping I never have to go through a self-defense shooting, which is why I'm a member of the USCCA. As a USCCA member, you can eliminate some of the stress of carrying a gun for protection by accessing the amazing wealth of firearm education, training, and current state-specific gun laws of your state or states you may travel to. This can help you be prepared for or hopefully even avoid a self-defense incident. As a bonus, members automatically become insured on the self-defense liability insurance policy purchased by and issued to the USCCA. Click below to learn more. And don't forget to subscribe to the channel, and most importantly, make sure you hit that bell symbol.